Dr. Giel with the Accident Recovery Center. We're located on Wilkinson Boulevard. We're in the Walmart Shopping Center on the corner of Ashley and Wilkinson. We're in West Charlotte. I want to talk to you today about something that a lot of patients ask me about all the time. Every time when a new patient comes in, especially after a car accident, at the end of the treatment for the first day, the second day, I always explain to them that, listen, you might be a little bit sore tonight. We're making changes with the body, and if soreness does occur, it's okay, and it typically only happens after the first couple of visits. And what I recommend is that they use ice over the soreness. 20 minutes on, 40 minutes off, and don't put the ice directly on the skin. You want something in between the skin and the ice pack. So usually I'll tell them use paper towel or something like this. The reason we want to use ice is because it constricts the blood vessels. See, when there's swelling and inflammation, the blood vessels are open, allows blood to flush in, inflammation flushes into the swollen area and expands the soft tissue and causes pain and tenderness. What we want to do is stop that or counter that, and the ice actually constricts those blood vessels and doesn't allow it to flush in there and swell up the area. So whenever there's swelling, whether you sprain an ankle or you've been in a car accident and you have pain and tenderness, immediately, initially, after the first few days, you always want to use ice. Okay? Constricts the blood vessels, and it's a natural anti-inflammatory. It pushes out the inflammation, okay, naturally. After a few days, then that's when we'll typically recommend heat. After the swelling has gone down, after the pain and tenderness isn't quite as much and they're responding to the treatments much better, then we'll move over to heat. Now the heat helps open up or dilate the blood vessels. That brings fresh blood in, helps flush out tight muscles, helps decrease the pain and tenderness, and helps decrease the tension and tightness in a muscle. Now, I always recommend when somebody uses heat that they use a moist heat. We give everybody a pack. It's a gel pack when they first come in. And this initially can be used as ice. Put it in the freezer, it freezes. And then after, you can thaw it out, and then it can be put in the microwave to be heated up. Now, I'll recommend that somebody uses a washcloth, runs it under hot water, wrings it out real good, then puts the washcloth over the area that we want to treat, okay, whether it be the neck area or the low back area, maybe a knee or so, and we put the hot washcloth over there, and then you put the heating pad on top of it. That helps drive in moist heat to the area, okay? If we just use the heating pad, it tends to dry out the muscle, it gets brittle, doesn't feel quite so good afterwards. If we use the moist heat, it helps keep moisture around the area, helps keep it softer, and prevents it from drying out and prevents it from being sore or irritated after the heat's taken off. My name is Dr. Ryan Giel. I'm here at the Accident Recovery Center, and we specialize in people that have been in motor vehicle accidents.